हेलो फ्रेंड्स, टुडे वी विल टॉक अबाउट हार्ट मर्मर्स एंड अपन बहुत इजी वे में इन्हें याद करेंगे कि डिफरेंट टाइप ऑफ हार्ट मर्मर्स को कैसे लर्न किया जा सकता है। इसके लिए अपन एक ट्रिक यूज करेंगे। उसमें अपन पहले एक 2x2 की टेबल बनाएंगे। ये हमने 2x2 की जो टेबल बनाई है, इसके ऊपर साइड में अपन डायस्टोलिक लिख लेंगे, जो कि इस पूरे अपर पार्ट को रिप्रेजेंट करता है। और एक नीचे की साइड में अपन लिख लेंगे सिस्टोलिक, जो कि लोअर पार्ट को रिप्रेजेंट करता है। नाउ लेफ्ट साइड पे अपन लिख लेंगे सारे स्टीनोसिस वाले मर्मर, एस वाले मर्मर। और लेफ्ट राइट साइड पे अपन लिख देंगे सारे रिगर्जिटेशन। तो आर for right, R for regurgitation. So we will write regurgitation murmur on the right side. Now we will mention the mid on the left side. So it represent the, for example, it represent the mid diastolic murmur and the mid systolic murmur. Similarly, we will write on the upper part of the right side early and on the lower part of the right side pan. So इस तरह से अपन को याद रह जाएंगे। अब अपन एक एक करके इसको फिलअप करेंगे, जो टेबल है उसको फिल करेंगे। ऊपर वाले पार्ट में अपन लिखेंगे मिट्रल स्टेनोसिस और ट्राइकस्पिड स्टेनोसिस, और नीचे वाले पार्ट में एट्रियल स्टेनोसिस एंड पल्मोनरी स्टेनोसिस। अपन को लेफ्ट साइड में पूरा स्टेनोसिस वाले लिखने हैं। अपन मिट्रल स्टेनोसिस से स्टार्ट करेंगे, उसके बाद ट्राइकस्पिड स्टेनोसिस पे आएंगे, उसके बाद अपन लिखेंगे एट्रियल स्टेनोसिस देन पल्मोनरी स्टेनोसिस। वैसे ही जो क्रॉस में अपन को लिखना है रिगर्जिटेशन वाले, जैसे यहाँ पर अपन ने नीचे लिखा था एट्रियल एंड पल्मोनरी, तो राइट साइड में ऊपर की साइड अपन लिखेंगे एट्रियल रिगर्जिटेशन एंड पल्मोनरी रिगर्जिटेशन। एंड क्रॉस करके जो राइट साइड के लोअर पार्ट है उसमें अपन लिखेंगे मिट्रल रिगर्जिटेशन एंड ट्राइकस्पिड रिगर्जिटेशन। नाउ we can easily remember by the table. If it is asked for the mitral stenosis, then we can directly say it is a mid diastolic murmur. Or if it is asked for the tricuspid stenosis, then also it is a mid diastolic murmur. Similarly, if it is asked for the atrial stenosis or pulmonary stenosis, then we can say that it is a mid systolic murmur. Or mid systolic murmur is also called as the crescendo or decrescendo murmur. Crescendo decrescendo murmur means the murmur increase from S1 to S2. In the middle part it is a maximum, then again it decreases. So it will show a wave like pattern. Firstly it will increase, it is maximum, the amplitude of the loudness of the murmur is maximum in the mid part of the systole, and then again it decreases as it reaches the S2. If we talk about the um, if we talk about the right side or the regurgitation part, then we can see, then in the regurgitation part, atrial regurgitation and the pulmonary regurgitation are the early diastolic murmur, and the mitral regurgitation and tricuspid regurgitation are the pan-systolic murmur. So now it is very easy for us to remember all the murmurs. Also, we will write some of the named murmurs, such as the Caricombe murmur, which is seen in the acute rheumatic fever, and we will write the Gram Steele murmur, which is seen in the pulmonary artery hypertension, and Austin Flint murmur, which is a murmur of atrial regurgitation. So we can see that all the named murmurs are also a diastolic murmur, except the murmur of the VSD, which is the Gibson's murmur, and it is a pan-systolic murmur. And the exception or the special murmur is of the MVP, which is the late systolic murmur. We have to remember it because MVP is very important, as it is the exception for many things along with the HOCM. Now we will talk about all the murmurs in the sequential manner. So in the heart murmur, we know that there are two types of murmurs, systolic and diastolic murmur. In the systolic murmur, firstly we will talk about the early, then it can be a mid systolic, it can be a late systolic, or it can be a pan systolic. So by the 2x2 table that we have learned, we can easily remember all these things in an easy way. And similarly for the diastolic, we have written on the upper part, and we can easily remember all the diastolic murmur from the 2x2 table. So we have to focus on the 2x2 table for remembering all the murmurs. Now in the many books, this list is given. In this all the diseases are given and all the murmurs are written, but it is very difficult for us to remember it directly. So by using that 2x2 table, we can very easily remember all the murmurs. The spatial murmur is of the patent ductus arteriosus, which is also called as the continuous murmur or the machinery murmur, and it is also named as the Gibson murmur after the name of the scientist. And the continuous murmur can also be seen in some of the other cases, such as the venous hump in the AV fistula and collaterals. So we have to remember these also. And this is the similar 2 by 2 table that I have already made. And we have to remember that all the murmurs on the scientist name are diastolic, except the patent ductus arteriosus, in which the Gibson's murmur, which is the systolic murmur. As we can see here also, all the named murmurs are diastolic murmurs except the Gibson's murmur, which is of the patent ductus, which is of the ventricular septal defect, and it is a systolic murmur. So it is written wrong over here. It is a ventricular septal defect. Now we have to see the exception, some of the exception, which is mainly present in the HOCM and the mitral valve prolapse. So all the murmurs decrease when there is a decrease in the preload, and all the murmur decrease when there is a decrease in the afterload. So murmur decrease with the decrease in the preload and afterload, and increase with the increase in preload and afterload. Now we have to remember some of the exception. The HOCM and the MVP murmurs, they generally increase with the decrease in the preload, and they decrease with the increase in the preload, and they increase with the decrease in the preload. So they are opposite to all other murmurs. All the murmurs decrease with the decrease in the preload and increase with increase in preload, but the exception is MVP and the HOCM. Similarly, for the afterload, when the afterload decrease, all the murmur decrease except the HOCM, MVP, and the atrial stenosis. So we have to remember another exception, which is the atrial stenosis. For the afterload, when the afterload decreases, all the other murmur decreases except the HOCM, MVP, and the atrial stenosis. And similarly, when the murmur increase, when the afterload increase, all the murmur increase except the HOCM, MVP, and the atrial stenosis, which decreases on increase of the afterload. And we have to remember then on inspiration, while we are performing the inspiration, all the right side murmurs are those murmurs which are present on the right side, such as the tricuspid stenosis, tricuspid regurgitation, and pulmonary stenosis and pulmonary regurgitation. These all murmurs increase with the inspiration and decrease with expiration. So this is all about the murmurs, and we have to remember the main 2 by 2 table, which is very important for remembering all the murmurs in the very easy way. Now we can also see this diagram, which is given in many books. It is also very easy. When we talk about S1 to S2, then it is a systolic phase, and when we talk about S2 to S1, then it is a diastolic phase. For mitral stenosis, as we know, we know that it is a mid diastolic murmur, and for tricuspid stenosis also it is a mid diastolic murmur. So we can make it in the diagram. In the diastolic phase, a mid diastolic murmur is this. So it can be represented for we can draw it for the mitral stenosis and the tricuspid stenosis. For atrial stenosis and pulmonary stenosis, we have written that it is a crescendo decrescendo murmur. So firstly it will increase during the systolic phase, then again it will decrease at the end of the systolic phase. Similarly, we can see in the pulmonary stenosis, firstly it will increase, then it will decrease. So it is a crescendo and decrescendo murmur. When we talk about the atrial regurgitation and pulmonary regurgitation, then we know that it is a early diastolic murmur. As we can see from the 2 by 2 table, it is a early diastolic murmur, atrial regurgitation and pulmonary regurgitation. So we can make it in the diagram. For atrial regurgitation, in the early part of the diastolic, we can write the early diastolic murmur, and in the in the pulmonary regurgitation also it is a early diastolic murmur. Now we talk about the mitral regurgitation and tricuspid regurgitation. In the mitral regurgitation, we know that it is a pansystolic murmur. So in the whole of the systole, the murmur will be seen, and it is not a type of the crescendo or decrescendo murmur. The loudness will remain same throughout the S1 between S1 to S2 in the systolic phase. So it is a pansystolic or the holosystolic murmur. For the tricuspid regurgitation, we have written the pansystolic murmur, but we have to remember that it is mainly a early systolic murmur. So we will draw it in the early part of the systole. Now we talk about the patent ductus arteriosus, in which we have learned that it is a continuous type of murmur or it is a machinery murmur. So it will be heard in both phase, systolic as well as diastolic phase. So it can be seen in both systolic as well as it will continue in the diastolic phase also. So and we have also seen that the continuous murmur is also present in the AV fistula, collaterals and venous hump. So this is all about the murmurs. Thank you so much.